We tend to pick up where the other programs leave off. And so in a lot of the traditional treatment programs, they want to get the person sober. And that's damn important. And 12-step programs, relapse prevention programs, all are really critical for getting under control, beginning to work the steps for some people. But there are certain people who the steps are not useful, they don't like it, and it doesn't work for them. And there's not been viable alternatives for that. And so you want to be able to not have one treatment for all, but to be able to offer different options. And so there's Buddhist Recovery, which sounds sort of esoteric, but actually it's really about finding a spiritual base to live by that's different than organized religion, and it's really quite powerful. In addition to that, people drink for a good reason.
First and foremost, addiction is a trauma-based disorder. And I think we're very, very good at addressing that along with primary substance abuse.
What we want to be able to do is maintain the skills of sobriety that they learned in their original treatment program and have them work their program. But then it's time to go deeper and excavate and find out what happened to them. And so our model tends to be trauma-based.
I think as unique and important and potent in treating addiction diseases, we view any problem, but addiction in particular, as being an attachment issue.
We're looking at what happened in their family of origin, what happened in their past. Oftentimes we find out that while they were in school, they were bullied and treated cruelly by other people, and they don't feel safe. So many of the people have what we call intimacy disorder. They use drugs and alcohol to distance themselves. And so they may be married, they may have kids, and they maintain the equilibrium of going to work every day and maintaining a family by staying numb all the time. And they just sort of do whatever the job requires, but they don't have any depth to them. They don't have real relationships with their kids. They don't have real relationship with their wives or husband. They're going around just sort of doing the next right thing. And they're functional, but miserable. And so what you want to be able to do is, by getting them sober, is wake them up out of their deep sleep and be able to find out, who are you? What is your life about? What are your values? What's important to you? And what's keeping you from connecting in a deep sort of way in your relationships with people? And usually it's about trauma from the past. They've been hurt very badly. And each time they're hurt, it's cumulative, and they step back a space and another space. And before they know it, they're so far back that they're alone. And so the secret to working with chemical dependency is to recognize how alone they are. And that's why the 12-step programs have been effective, mostly because you go there, you're with people who are of your tribe, and for the first time you feel like someone gets you. And that's what helps you get better. So having a therapeutic community and having a group of people who get you allows you to be able to at least see the development of the real self. And then from there, you begin to build real relationships with people and look at what it is that's blocking you. So to me, the real cure for addiction is to understand it as an intimacy disorder and to help them not be so alone and help them develop real relationships with people.